monobloc or modular stems. So looking at a historical perspective, there was a divide across the Atlantic, whereas Charlie Young and Young Jr. always said we had to put the cylindrical cobalt chrome stem, and that was very popular in the US at that point in time, 80s and 90s. Whereas across the Atlantic we had the Heinz Wagner designed the Wagner stem in 1985, that's quite a long time ago, and he talked about the concept of a fluted tapered titanium stem. So this was the philosophical divide those days. And we find that the cobalt chrome stems, cylindrical stems give a lot of problems, and we have stem breakage, stress shielding, there's no regenerate, and secondary engagement cannot occur. And these are, in fact, now even between Dr. Surya Narayan and myself, we have revised 16 of these cylindrical cobalt chrome stems into fluted tapered titanium stems. And 2 examples I have shown here. So that's a very, very high failure rate with those stems. So in 2025, the fluted tapered titanium stem is the gold standard. There's no question about that. So many failures that we have come across. And the message to the audience is 2025, you must not be using any more of these cylindrical cobalt chrome stems. They have got a very, very high failure rate, and you have to use only fluted tapered. This is the gold standard in 2025. Now the question is, should we be using the Wagner type, that is the most popular stem in India in all the cases? Now the Wagner has some problems, and the 2 problems that comes across in literature are the rate of subsidence is pretty high. Somewhere between 20, somewhere in the vicinity of 20%, that's pretty high. And dislocation rates in the instance of between 5 and 10%. That again is a high percentage. So the Wagner is not without problems, although one can undoubtedly say that that is the gold standard. And that has been the workhorse in my practice. So our own cases of Wagner problems. The first case on top, you can see that fairly well-sized stem, everything is fine, and you can see that it is subsided. You can't criticize that it has been undersized or anything like that. Then the other patient below complex revision we have done, we used a Wagner, and that has dislocated, probably because of a little bit of subsidence, and maybe because there were other issues as well. So it's not that that the Wagner is without any complications. So the question is how to solve this problem. So the obvious answer was you had to introduce some modularity. So in the US in the early part of the century, we had a lot of designs of modular stems to address this problem with the monobloc Wagner stem. So the modular stems are certainly more resistant to subsidence and dislocation, no question of that. Now why is that? That's because when with the modular stem you independently achieve fixation. So don't worry about the proximal what soft tissue balance that you want. You achieve, you size whatever, wherever it takes you, wherever it seats, you go ahead, you fix it, get distal fixation first, and then you do your proximal part. You can keep adding 10 centimeters, 20 centimeters, whatever it is, and you can get your soft tissue stability. Because we are getting 2 of these goals independently, it becomes superior to the monobloc stem where everything has to be done in one step, and that's where sometimes we fail to get that. The second how it works better is that it's not only the length that you can alter, you can also alter the circumference of the proximal segment, and therefore it gets what's known as a secondary stability. So apart from your primary stability of your fluted tapered titanium stem, you also now get a secondary stability, and that's how it's superior to a monobloc stem when it comes to revision. The third thing of course is the availability of curved stems. Sometimes you have both femurs, and you get, and especially if you are doing an endofemoral route, you need to have a curved stem. And these are the 3 distinct advantages of modular stems or monobloc stems, and that's how they are superior in all these aspects. However, there's a yin and yang to everything in life, and whenever you introduce modularity, you introduce the problem of having breakage. So all of these modular stems have gone multiple iterations before these problems were addressed, and whenever you introduce a modularity and you have proximally it is unsupported, then you are at a risk of breakage. So the surgeon today is a dilemma whether to use a monobloc stem on a given case. And actually we get lots of X-rays on WhatsApp saying, sir, can you tell me which stem should I use in this case? So when is a fully modular stem mandatory? The one situation would be that when you want to do an endofemoral revision with a relatively long stem, like the one that Rajesh showed as well. When you have a long stem, you're not doing an ETO, you need to get the long stem inside, then you have to go modular. You will not be able to get rigid fixation with a monobloc stem. You will have to sort of make up your stem as you go along, get distal fixation first and get probably some secondary fixation later on, and that's an absolute indication for a modular stem. It's very difficult to do that with a monobloc stem. Now, when does monobloc score over modular? This is the paper from Germany where they have used the Wagner for osteosarcoma and bone tumors, proximal femoral bone tumors, and you have zero bone support here. Absolutely zero bone support, but still the Wagner works very well. It's reassuring to note that there's no reported case of a Wagner fracture in the entire English literature. That's very reassuring to note that fluted tapered titanium stems will not break on you even if you don't have any proximal support. And one of my cases as well I've used for osteosarcoma, only distal fixation, zero proximal. So this is an absolute indication where we'll use a monobloc stem. So another indication where you have a femoral transaction like that, you're only going to have distal fixation, and you will not use a modular stem. In this case, you will use a monobloc stem. So that's sort of how you choose which condition to you do what. So to summarize, monobloc is cheap, very important in this part of the world. Never forget the economy of the whatever that we're trying to do. It's easier to use, less inventory. The modular stems have certainly less chance of subsidence. I've showed you why, 3 reasons. And availability of a curved stem is also an advantage in some special situations. The monobloc has got a risk of subsidence and loosening, whereas the modular, you need to have proximal bone support, and if you don't have, you risk breakage of at the junction, and of course very expensive because it comes with a lot of modular components. So the yin and yang to that, and we need to match that. So the thing that we could probably do is to try and combine the advantages of both, and so that's what we try to do with the monomod system that we developed. The monomod means we combine the monobloc, the advantage of the monobloc as well as the modular, and that's why we call it the monomod. So instead of having a modularity, we introduce 2 steps whereby we get what the modular stem achieves independently, get fixation as well as stability in 2 individual surgical steps, and therefore we could achieve the same advantage of the modular, but this time using a monobloc stem, and that's what we designed as the monomod stem. So it comes with a REMA, so 2 markings, one to get distal stability, one to get proximal distal fixation, and one to get proximal stability. So 2 steps but using a single monobloc stem. So the first step is a primary provisional stem where we get only the soft tissue balancing, and then we go on to the secondary step where we get a secondary scratch fit using the same reamer but using different markings to get that. So that's what we try to combine the advantages of both. Then of course the modular stems give you advantage of having a secondary protection by increasing the circumference of the proximal fragment. So we designed this proximal femoral augment. So it is a 3D printed titanium augment off the shelf. It's not custom made, but in case you find that the distal fixation isn't very satisfactory, osteoporotic bone, etc., you can add on an proximal femoral augment after you have put in the monobloc stem, not before. After you put in, you can, if you have a very capacious proximal fragment, you can add an augment onto that. So that's how we got secondary stability. Now the taper angle is very important for us to understand. The Wagner has got a low taper angle by today's standards. It has got a taper angle of 2, whereas the high taper angle stems are like the Redart, which have got 3. The 3 angle is fantastic, but you need long bones, because for a given segment of bone, the area of fixation is less as you increase the taper angle. So for long bones, it's great, but for our patients, may not be a great idea. But the Wagner 2 is a very low taper, and that also contributes to the subsidence. Therefore, we incorporated an angle of 2.5 so that you could get the advantage of both these systems. Now, the other problem with the Wagner was when you have a situation like that, you have no proximal landmarks at all. So just guessing, and when you eyeball the version, whether it's 20 degrees or whatever you want to keep, then you sometimes land into problems. And therefore, we introduced this introduction device where if you could align the device to the tibia or the functional version, then you could dial in either 10 degrees, 20 degrees or 30 degrees or whatever that you want, and that's how you'll be very accurate, and suddenly this system becomes very accurate when you want to dial in your version. So you can see that thing has been managed like that. So in summary, I'd like to say that the fluted tapered titanium today in 2025 is the gold standard. Cylindrical cobalt chrome stems must not be used due to their very high complication rate. In some situations, the modular scores over the monobloc, and others the monobloc is better, as explained. The Wagner stem developed in 1985 has been a phenomenal workhorse, but has got some issues which can still be improved. I thank you for your attention.